Is it possible to go overboard on vitamin B12? After all, just 1 milligram of vitamin B12 is already over 40,000% of your daily value. In this video, we'll be going over B12 dosing, what is a safe amount to stay within, who vitamin B12 may be best suited for, testing of B12, as well as some safety tips when it comes to it, so stay with me till the end. And real quick guys, before we get started, it would mean the world to me if you hit the like button down below for the YouTube algorithm and turn the bell on to stay up to date with new weekly videos. And yes, the average intake of an individual in the US is approximately 3.4 micrograms per day. So the average person might not run into a deficiency issue since your animal products such as meat, dairy, and eggs are really the only sources of B12. And I think most of us are actually eating these foods, but I did want to talk about the group of people who may be more prone to deficiency even with eating these foods, because B12 deficiency is still possible even if you eat animal products. Now, I already made a detailed video on that looks at B12 in more depth that I highly encourage you to watch after this one. You'll learn even more about it there. But if we're getting about 3.4 micrograms a day, isn't that how much we need? Well, the recommended dietary allowance for men and women ages 14 years and older is 2.4 micrograms daily. For pregnancy and lactation, that amount increases to 2.6 micrograms and 2.8 micrograms a day respectively. And speaking of the types of vitamin B12, because vitamin B12, as you know, contains the mineral cobalt, and the compounds with vitamin B12, the activity are called your cobalamins, right? Well, methylcobalamin and 5-deoxyadenosylcobalamin are the metabolically active forms of vitamin B12. The other two forms, hydroxycobalamin and cyanocobalamin, become biologically active only after they are converted to methylcobalamin or 5-deoxyadenosylcobalamin. And when it comes to food, even more vitamin B12 is released from the food it's in when you have enough hydrochloric acid and gastric protease in the stomach. And the freed vitamin B12 combines with intrinsic factor, which you can think of it as a chauffeur since it will deliver the B12 to the right areas in the body. But not everyone has intrinsic factor, which is another video that I could talk about. And once it's absorbed, vitamin B12 is used as a cofactor for enzymes that are involved in the synthesis of DNA, fatty acids, and myelin. This is exactly why when you have a deficiency in B12, it can lead to hematologic and neurologic symptoms, nerve pain being one of them. Also on this note, this is why when you take, for example, a B vitamin complex supplement, you get this boost of energy levels and mood, right? And people who have a B vitamin deficiency may actually feel a rise in energy levels after using the supplement because the vitamin is directly involved in making healthy blood cells, giving you instant energy. But what happens to all that vitamin B12 that we take? If we only need 2.4 to 2.8 micrograms, isn't 1,000 micrograms or 1 milligram way too much? Well, to answer that, vitamin B12 is a water-soluble vitamin, so any unused amount will exit the body through the urine. Generally, up to 1,000 micrograms a day of an oral tablet to treat a deficiency is considered safe, so that's not to worry. The Institute of Medicine actually states no adverse effects have been associated with excess vitamin B12 intake from food and supplements in healthy individuals. But this doesn't mean you go overboard, guys. Testing B12 will be your best friend so you can have real data in front of you. And before we talk about testing, let's talk about why your B12 may be low even though you are getting, let's say, 2.4 micrograms of it. There are about 5 reasons for that. 1, it can occur if you have an inflammation of your stomach lining or Crohn's disease. 2, it could be medicines that lower it, like your antacids and proton pump inhibitors such as Prilosec, Protonix, Pepcid, which can also lead to B12 deficiency because they reduce the stomach acid, which is necessary to release the B12 from your food. Metformin can also decrease absorption of B12 in the small intestine, but only for about 10 to 30% of people. And lastly, age. Multiple studies show a deficiency in 10% to 24% of people 75 and older. The causes may be both inadequate intake and also inadequate absorption, because intake and absorption are 2 different things. And significant B12 deficiency can lead to anemia, nerve damage, and possibly even dementia, which is why it's so important to keep tabs on these levels. Now, in my last B12 video, we talked about testing, but I wanted to bring up another test you can add. Your initial lab test should include a complete blood count or a CBC with a peripheral smear and serum B12 and your folate levels. Guys, Sometimes that's not enough though. In cases where it's still unclear, then you can get the MMA and the homocysteine tests too, which we mentioned in my last video. And if your B12 is low, the CBC would show anemia, which manifests as a decrease in both hemoglobin and hematocrit. Also, the mean corpuscular volume, or the MCV, which measures the size of the red blood cell, would be increased to a level greater than 100, which can be a case of macrocytic anemia. But at the same time as your serum B12, you should also test your folate levels too. Folic acid deficiency also looks like macrocytic anemia, and it's often confused with B12 deficiency. But ultimately, when you're on your journey of restoring your B12, there are 3 things I want you to know. The first, since B12 is a water-soluble vitamin, it's generally considered safe, even at high doses. Some supplements can go as high as 2 milligrams and up. This is because there's no tolerable upper intake level, which has been established for B12 due to its low level of toxicity, but that doesn't mean you go overboard either. Sticking to 1 milligram might be the best solution, and rechecking the levels down the road. It can sometimes take up to 6 to 12 months to fully restore your levels back to normal. This is why it also is common to not experience any improvement during the first few months of treatment. So with this one, you gotta be patient. The second pro tip is people who eat only a vegan diet are often told to eat brewers or nutritional yeast so that they could get the B12. But yeast does not naturally contain this vitamin. It has to be fortified with it. So be aware that certain brands won't have B12 in them. It's the same with nori. Not all seaweeds have B12 either. The third tip is, once your B12 level is normal, taking additional B12 has not been found to be beneficial. We often think that more is better, which is not the case. Some people will even take B12 shots. But with the shots, keep in mind that they are typically used to treat vitamin B12 deficiency caused by pernicious anemia, as well as other conditions like pancreatic insufficiency, or if you have malabsorption issues and let's say you're severely deficient in it. Most people will do just fine with supplementing by mouth. There has been tons of money poured into the marketing done with B12 shots and weight loss, but the reality is, if mega doses of B12 have any benefit on weight loss, it's probably a placebo effect.
B12 is having a moment. It's promoted as an energy booster, and celebrities swear by it.
A lot of this is that power of placebo.
This gerontologist rarely prescribes monthly B12 shots. He says for most seniors, store-bought tablets may actually work better.
There is no conclusive evidence that B12 trims your waistline and that you need shots of B12 to lose weight. Don't believe in these silly marketing campaigns designed to target your insecurities. And if you're in the market of finding a B12, the one I like is the one by Thorne. They use the natural version, methylcobalamin, which you can check out in my Thorne store down below. It's exactly 1 milligram of B12, which is well thought out, like all their supplement formulations. Or you can also go with their B Complex number 12, which has all your B vitamins like B12 and your folate as well. Once you're in my store, you can check out my entire shop as well as my top 3 favorite supplements. But I'm more curious to hear from you guys though. What are your thoughts on vitamin B12? I know that this was a long video. Leave them in the comments below, like the video if you found it useful, and I'll see you guys on the next one.